More than 1 million people in the U.S. are living with one of many types of blood cancers, including chronic lymphocytic leukemia, or CLL. It's one of the most common types among adults. Now, here to raise awareness about CLL are blood cancer expert Dr. Fernando de Zaraga and Frank Martinez, who is actually a survivor of CLL. Thank you both for speaking with me and explaining this morning.
So thank you for having us. We're here on behalf of Genentech to create and raise awareness of blood malignancies in general, and specifically CLL. So CLL, as you mentioned, is chronic lymphocytic leukemia, and it is a cancer of the blood and of the bone marrow. So in general, what we see is uncontrolled growth of the white blood cells, and that can manifest in a number of different ways. But the typical person that gets CLL is a person that's 70, 71 years of age. So as we get older, the likelihood of developing the disease increases. It's seen more often in males than in females, and in certain ethnic groups and geographical areas. For example, in North America and Europe, it's much more common than it is in other parts of the world. In terms of what the typical presentation is for CLL, usually, although there can be variability in terms of how people are diagnosed with CLL, the most common presentation is actually someone that doesn't have any symptoms at all, but rather goes to their doctor for a routine checkup, a routine physical, and then routine blood work with the most basic of all blood tests, the complete blood count, or CBC, will often yield an abnormal white blood cell count. This is usually done in the primary care's office, and a limited investigation will take place to try to figure out why the white blood cell count is elevated, but it usually will not give the primary care the answer, and that's when patients are sent to us, the hematologists, so that we can investigate it more thoroughly and try to explain why the white blood cell count is elevated. Sometimes it ends up being a diagnosis of CLL.
Frank, tell us about your experience living with CLL, and how are you doing today?
I was diagnosed in 2007. At the time, I was working in a hospital as an X-ray technologist, and the hematology department was next to us, and they had bought a new equipment to test blood, and they asked me to be a volunteer, so I did. A few minutes later, they told me that the equipment was doing fine, but my blood test was abnormal. And they suggest to see a doctor. So I went to see Dr. Fernando de Zaraga, and he did some bone marrow biopsy and PET scans, CTs, ultrasound, etc. And it all came out with positive for leukemia, CLL. He advised me that I did not need any therapy, and that I had to be observed, and being observed and seeing the doctor every 4 months for almost 5 years. In 2013, I had a severe leg infection, and I was told that I need treatment. So Dr. de Zaraga told me that he was going to put me on Ongasaiba and chlorambucil chemotherapy. As a result of that, I'm in remission right now and having a good quality life.
And doctor, what resources are available for people with blood cancers like CLL, and where can they really find them?
There are several websites online where I direct my patients. The American Cancer Society is an excellent resource that patients can start, as well as the Leukemia and Lymphoma Society. Both of those provide excellent starting points to not only learn about the actual disease of CLL, but learn about the treatment options that may be available to them.
Thank you both for joining me this morning.
Thank you very much for having us.
Don't go anywhere. The Morning Blend will be right back.